This is Meredith for Real, the Curious Introvert, and I'm Meredith. Around here, we explore taboo questions and societal blind spots. Each high contrast guest gives you the layered deep dive you crave, not just the Google results making headlines. My mission, and yours if you choose to accept it, is to inspire curiosity by exploring the nuance and paradox of our world. Each episode is different, so bring your ADD and your earbuds and have a look around. Mental health language becoming mainstream has helped us in a lot of ways, but it's also created some confusion when the words get thrown around pretty casually. And one of those words is depression. My guest helps unpack how to really know the difference between depression and sadness, including examples of what your inner dialogue might sound like, symptoms in men versus women, and a really helpful timeline of symptom longevity. This episode is a remastered favorite brought to you because you, or at least those of you in my private Facebook group, have asked for more mental health episodes recently. If you would like to give input on future episodes, consider this your official invite to that group. I also post content in there that I don't post anywhere else, and I do occasional giveaways. You can search MFR Curious Insiders on Facebook or click the link in the show notes to request to join. I hope to see you in there. And if you end up liking this episode, you'll also like the new Spotify playlist I made, all of mental health episodes. I put it in the show notes. But if Spotify isn't really your thing, you can check out the episode about grieving, which is episode 267. All right, friends, keep it curious.
It does not take an in-depth, double-blind, peer-reviewed research study to know that 2020 has been a mental health shit show. It doesn't take reports of people experiencing depression to know that depression is up. But that word, depressed, what does it actually mean? How is it different from sadness? Has 2020 made new rules? My next guest has over a decade of treating mood disorders, more than qualifying her to shed some light on the subject and help us get unstuck. Professional unsticker, home chefer. Here to give us the 2020 Survivor's Guide to Depression, Dr. Megan Stodard. Thanks for coming.
Absolutely. Thanks for having me.
I definitely want to figure out the definition of depression because I read that people who watch Netflix series in a binging way, that they experience depression after the show is over. And I thought, I don't know if we're using that word, and I don't think you know what it means.
Are we meaning what we think we mean?
Yeah. So, and I have some listeners who are very concerned about The Office going off air.
It is concerning.
It is concerning. So we should probably start there with the definition of depression as it relates to our Netflix favorites.
Well, and I think that as this word depression has made its way into our common language, I think we've started to use that as a word for really sad, right? I'm depressed, which I think means I'm extra sad over this.
Yeah.
And it's really more than that. So yeah, I want us to talk about what is that difference and how do I know? Am I sad? Am I really sad? Am I depressed? Are these things the same? Are they related or what?
Yeah, because we only really have that one word. In English, I just realized that. We have sad. And then below sad are I'm feeling down. But nothing is, we go from sad to depressed. There's nothing really in between.
and in reality, there's a lot of things in between, right?
Yeah. So walk us through that, will you?
Yeah. So sadness, we'll talk about that for a second. And I think that's one that, we know when we feel it and we know when we see it. I don't know that sadness needs a whole lot of explanation. But when it comes to depression, that's when there's a lot of questions. People are like, am I sad or am I depressed? Or how do these, are these the same? So depression can definitely include sadness, but it is more encompassing and more pervasive than sadness alone. So sadness as an emotion is something that we expect can sort of come and go. It's transient, and it's typically in response to something, right? Maybe it's our Netflix series ending and we're feeling really, really, really sad about that. But it's usually about something, in response to something. If we're depressed, it may or may not be in response to something. But going back to what I was saying, that it can include sadness. It may not be, I feel like I'm crying all the time, sadness. I can be a low mood. It can be something that's more of I'm feeling apathetic or I'm feeling sort of numb, as we call it, that I'm not enjoying things. I'm not interested in my normal way. But it also includes things outside of mood. So a lot of times we see impact on motivation. We see cognitive impacts. So lots of trouble with focus and decision making. We're hearing a lot of that right now.
Yeah.
Problems with sleep, changes in appetite, which can sometimes be related to changes in weight that can be going up or down, can be thinking of death, and not just in a I'm wanting to hurt myself or I'm suicidal, but just kind of that thought, that theme is around a lot.
Yeah.
And so it's beyond just a feeling or a mood. It's encompassing some of these other symptoms as well. And then the other thing that we think about when we're going, okay, is this sadness or is this depression? We're thinking about the frequency of these symptoms, the intensity, the duration, how long are they lasting? So where sadness is transient, right? This thing might happen. I might feel sad about it for 30 minutes or a day or so. Depression, if it's a diagnosable episode, it's at least 2 weeks where this really isn't breaking.
Wow. So there's probably like a lot of people depressed right now.
You're right.
Yeah.
There are. And then there's the impact question, right? So whether we're sad or whether we're depressed, how's it impacting you? And I think a lot of times we're looking for like this imaginary line in the sand.
Totally.
Right? And like you said, there's sadness and there's depression. And realistically, we know there's a lot of things in between that. And there's not always this definitive line. Oh, I'm sad. And now all of a sudden I've passed over this imaginary line and I'm depressed. Right?
Yeah, we want waffles, but life is spaghetti, right?
Right.
Like, no, give me the exact coordinates of depression.
Waffles, bento boxes. We like these,
exactly.
Organized things.
The bento box, yeah.
Yes,
bento box of emotion. Now I am depressed. I was sad, but here we are
in this one moment now. I've crossed over into this other compartment, right? Yeah. So hopefully that helps to answer some of that.
Well, it's interesting that sadness can be in depression. I really thought it was this or that, not this and that.
Yes. And I think that's what makes it even more difficult as we're trying to answer that question internally for ourselves, right? Well, is it this or that? Oh, well, they're spaghetti.
Life is spaghetti. So damn messy. So is it healthy to feel sadness?
It depends, right? What a psychologist answer.
That is a psychologist,
right?
Yeah.
But to unpack that a little bit, I talk a lot about how all emotion is human. And emotions are the things that give us information about what's going on in our environment, what's going on inside of us, and our circumstances. They're kind of our little navigation lights.
Yep.
And so is it bad to feel sad if it matches your circumstance? That's the thing that helps us to sort of guide through what's going on. Where we can be concerned is if there's a big mismatch between what we're feeling and what we're experiencing.
That is a very good point. And it's tricky right now because there's a global reason to be sad. Yes. However, my situation is remarkably better than so many other people's situations. So then you have that shame that is spaghettified into the situation.
I love that word. It's spaghetti. It's spaghetti. Spaghetti right now.
Yeah, because you think, well, I am well physically and my family as well. I am not having to homeschool any tiny people. So all is well, except for it isn't. Yeah. So that's interesting. I have a couple listener questions, if it's not too soon to dive into these because they were really good. Sandra Goodwin asks, how do you know when sadness has turned into an unhealthy, dangerous depression? Because there again is that scale, because you talked about 2 weeks is a great time measurement of threshold.
Right.
But she said, the dangerous kind. So that's again yet some other mystical, vague threshold.
Right. And dangerous is a tricky word too, right? Like what do we mean when we're saying dangerous? But I think that answer comes back to impact. And it's less about, I think, figuring out, have I crossed that imaginary line in the sand? And more about whether I'm sad, whether I'm depressed, how is it impacting my day to day? Right? And is is this getting in the way of you taking care of your responsibilities, but also the fun things in life too?
Mm-hmm.
Certainly, a lot of times when people are using the word dangerous, they are talking about self-harm. They're sort of indicating maybe there's some suicidal ideation. If any of those thoughts are coming or going, it doesn't mean that, oh, it's about to happen right now. It may not be that it's imminent, but even if those thoughts are fleeting, that's a time to have a conversation about it. We dove deep. The first question, right?
Yeah.
But yeah, I mean, if those thoughts are coming or going, if you're starting to feel helpless, if you're starting to feel hopeless, meaning there's nothing I can do and it's never, ever going to get better, that's a time that we could be approaching some more severe things for sure.
That would be a clue. Yeah, I was talking in another episode that I just recorded about how I feel like my body and my mind leave me clues on how I'm doing.
They do.
Which makes me sound like I have multiple personalities for it.
But it really doesn't. It means that you're paying attention.
Yes.
Because all of our bodies and our minds do that. We're just not all paying attention all the time.
Right.
Yeah.
And it's so much of it does come into paying attention and listening to your body and listening to your mind. And everyone's so different, which makes it, not only is the situation different for everyone, but meaning like your life circumstances, but also how the impact plays out.
100%. Yeah. So while we have, these symptoms and these timelines that we're looking for, it's not a cookie cutter thing.
No.
Right. Yeah. I mean, no two people that walk into my office or call me that have depression look exactly alike. So that's the other part of it, is the impact, but also that it's a change for you. Right?
Oh, right.
So like your baseline for focus and your baseline for mood and your baseline for motivation is different than anyone else's. But if you see a shift and there's a change for you, and like you said, your body and your mind are giving you those clues, then okay, this is a shift for me.
Yeah, that's so good. I'm interested in that word that you said, baseline, because one of our listeners had a question about that. She was talking about having a family member presents with ADD and anxiety and has been professionally treated for depression and addiction for 20 years. Are there any programs to help someone go off all of their medications and drugs safely to determine their baseline after years of ineffective treatment?
Whoa.
I know. I was like, dang, Kathy. That was.
So if I'm hearing the question correctly, it's basically sort of the question of we're in spaghetti, right? Like what's what?
Yeah.
Right? What is experience? What is medication? What if this person is still not well? How do we sort of strip away safely all of these confounding factors? And while there are absolutely ways to do that with caution and under very close supervision, never would we want to just start making all these drastic changes on our own. Yeah, but that's a really good point, right? What's left?
Right. Well, if you think about how many Americans, and I'm sure people worldwide, use some sort of medication, it's pretty common.
Right.
And even birth control is a hormonal therapy, and it has significant mental impacts on well-being, and women are on that for decades. And so how are they even knowing their baseline necessarily? But the point is, we all have these varying factors, spaghetti. We'll go back to that.
Well, and they are spaghetti, right? They are all interrelated, and we like waffles and we like bento boxes, and it's a little bit easier for us to sort of think, oh, well, this medication that I take is only for this, and it stays in its box over here.
Yeah.
And it's just not always the case. So I think it's really important to have a big picture perspective for our health and our care, and making sure that whoever your providers are coordinating care with one another, and that it's not, this person over here is in this box, has no idea what this person over here in this box is doing. And as the client or the patient, it's really important that you advocate for yourself in that too, right? Big question.
That was a big question. I know I gave you two hard hitters, like right out of the door.
That's okay.
So, I mean, if I was going to summarize kind of what you said to respond to her question, it would be that her family member would need to take ownership of his or her state and what do they want and what are they willing to do? And then if there is a program, I'm imagining some sort of like rehab
Someplace.
center. Because as you said, you would need very close supervision.
Right.
I don't know if that exists, but it would be, and it would need to be done in a very careful way.
Right.
So, but it sounds like overall listening and observing oneself is the most important, and giving names to the different states that you're in. Darn that language.
Right. And are we saying the same thing? Do we mean the same thing when we use those words?
Does sadness present differently in men and women?
So before we even go there, I think it's really important to kind of lay the foundation and understanding that individual differences are always more significant than group differences, right?
Oh, okay.
So what we mean by that is, like I said, 100 people can sit with me, and all 100 of those people can have depression, and that's going to look different on all 100 of those people, whether they are male or female, right?
Yeah.
However, we do see more in women of the sadness, the worthlessness sort of symptom. Oh, and guilt with women too is a big one. And in men, a lot of times we see more of fatigue. So saying I'm feeling tired more than I'm feeling sad and tearful. We see more irritability, and a lot of times we see more anger, which is really interesting because if we're interpreting depression, like we were talking about earlier, to mean really, really sad, that's not registering.
Right.
Right. And so we've already sort of established that that's not actually what depression is, right? It doesn't just mean extra sad.
Yeah.
So those are some differences that we see pretty often. And again, there are plenty of women who can present with a more irritable, fatigued, or angry depression, and the same for men.
Yeah, I could definitely see it presenting different, just even from a societal expectation point of view.
Yes.
Because, well, also, I feel like when God made women, he was like, here's a uterus, here's some guilt. Have fun. Like it came with the package or something.
Here's some guilt. Just a little present.
Knock yourself out. I'm sure that's how God talks, like that, with the shoulder. Yeah. And, and so we carry a lot of responsibilities and then we feel bad when we can't carry them out because we are forgetful or have brain fog or whatever. So I could see that. What about teens and preteens? Two different listeners, Megan and Leslie, asked, what about preteens and teens not knowing how to acknowledge changing hormones, sadness, and depression? Leslie said that she read that teens feel 10 times more than adolescents due to their pending brain development. Sorry, kids, that's a fact. So if sad, they're 10 times more sad, and happy 10 times more happy. And just feeling all of those things in a bigger way, for sure. And then the other part of it is the hormonal part, but the experience part too, right? So as we get older, our brains develop, and so there's that piece, but there's also, okay, now that I am further along in my life, I've had more times that I've felt really sad, or I've had more times that I've felt really angry. Yeah.
And I've learned some things about myself, and I've learned that for the most part, these things are going to come and they're going to go. And it's not quite as scary the more times we have felt them. So if you have teens in your life, whether they're your kids or your family members or your students, I think we do need to have a little empathy that this is the most heartbreaking thing they've ever experienced yet in their life.
Yeah.
Right?
Yeah.
It's their first one or their second one, but it's not their 100th one yet, we hope. For some kids, it might be, but for the majority, probably not. I don't know if that makes some sense.
It does. I was just thinking about all the kids and imagining myself as a kid right now, feeling about missing graduation and missing all those things. And I read about these things and I keep on scrolling through, and I don't give them much thought because I don't have kids myself. And it's been a while since I've been a teenager. So
it's not your biggest thing, but it's their biggest
thing. Oh, but wow, that really, like, it just kind of broke my heart for a minute, like thinking about how they must be feeling that this is like literally the worst thing that's ever happened to them. And it's so sad.
It, probably won't be the worst, but right now,
God,
it's the worst
don't
so far,
say that,
right?
Megan. Tempt 2021.
No. We're only talking about the category of graduation. Only. Not all of the things.
Yes. Hey, Curiositors, just a quick pause to show gratitude to our sponsors and give you some special deals. From time to time, I recommend other podcasts you might like. And here's one I know that you're going to love. It's the Jordan Harbinger Show. I love it because it's smart without being too highbrow and 1,000% ADD friendly. I know, you love it already. I'm a genuine true fan. When I have time to listen to podcasts just for pleasure, not, guest research, the Jordan Harbinger Show is my automatic choice. It's like when you're hungry and someone asks you what you want, and then before you even have a minute to think about it, you find yourself at Chick-fil-A because, obviously, Jordan's the Chick-fil-A of podcasts. Some of my favorites include the one with the man held hostage by Somali pirates, that's episode 115, and the pain psychologist about how pain lives in the brain, not in the body, episode 661. You can't go wrong with adding the Jordan Harbinger Show to your rotation. It's incredibly interesting and there's never a dull show. Search for the Jordan Harbinger Show, that's Harb as in boy, I, N as in Nancy, GER, on Apple Podcasts, Spotify, or wherever you listen to podcasts. The Florida Panhandle isn't just the home of your favorite podcaster. That's me, by the way. Shameless, I know. But it's also a go-to spot for a lot of families on vacation. Don't plan a Pensacola trip without getting tickets to the UWF Historic Trust. It's good for a whole week, and it's a great indoor activity option. You'll recognize Trader John's where I record the show in the Pensacola Museum of History. Get your tickets in person so you can show the agent one of my emails and get $2 off an adult ticket. historicpensacola.org. Now back to the show. Remember to stay till the end where I give you a sneak peek of next week's episode. So in general, across age and gender, are there different things that we can easily put in our back pocket, if you will, for differentiating those self-assessments of, am I sad? Am I depressed?
Right. So for kids and teens, a big thing that we see, again, it's kind of going back to, it's a change from their baseline.
Okay.
So a change from what is their normal, right? A lot of times we'll see behavioral changes, and that can be internalizing or externalizing. So internalizing is sort of the picture of the kid who's withdrawing more, isolating. Externalizing is the kid who suddenly, out of nowhere, you're getting all these phone calls that they're getting into trouble at school. But again, that's a change from their baseline, meaning this doesn't sound like them. This doesn't seem quite like them. For younger kids, we can see things like school refusal. So when we usually say school refusal, it means like, I'm not going to go to school today and you can't make me. But that's one that we see a lot, or we see nervousness or worry, anxiety about being separated from mom and dad or whoever their grown-ups are when they're younger. I think the big thing that we really need to be looking for are changes from baseline.
Yeah.
Right.
Okay.
So this does not feel like myself, or this does not seem like their normal self.
Okay.
Impact. So it's something that is getting in the way of your day-to-day tasks, whether those are responsibilities or the fun things.
Mm-hmm.
And, I kind of always say it's not a problem unless it's a problem. Right?
Yeah.
So thinking about the impact and just noticing, hey, am I taking care of the things that I want or need to in a day in my way that's my baseline?
Right.
Or am I really not feeling that way? Right. And is it a forcing where it's not normally a forcing?
Yeah.
Yeah.
So I was recently talking with a therapist about anxiety, which is another fun episode that's coming fun. But he said something that really made an impact with me, which was, anxiety isn't permanent. So can the same be said about depression, even in the current state of affairs?
Right. Most times that's true. There are some people who are diagnosed with a lower level, more chronic type of depression that can really tend to stick with them. Most of them really do much better with a combination of medication and therapy. But the type of depression that we're talking about a lot today, which is circumstantial, kind of a sadness, it starts as a sadness in response to something and then sort of morphs into some of these other things, motivation, sleep, eating, all of those changes. It's a really good point that even if it's there to some degree, the intensity of it is probably not going to be
a permanent state.
Absolutely. So, and that's another thing too, is we talk a lot about like, oh, does this person have a diagnosis? A lot of diagnoses are a snapshot in time, right? So meaning right now, a person may meet criteria, but in 3 months or 6 months, they may not.
And that's why I can totally see why it goes back to that self-assessment
Yes.
and observation. And so as we wrap up, can you speak to treatment? Because we've got this huge spectrum.
Yeah.
We've got a little down to chronic, severe depression.
Right.
And everything in between.
And everything in between.
And then all of the spaghetti.
And all the spaghetti, all of it, yes.
And all of the meatballs and all of the things, right? So does everyone need to see a therapist? Does everyone need medication? What do you try before those things? Am I even wording that wrong? You know what I mean? Like to me, like, oh, you saw a therapist must be pretty bad. So I'm self-assessing right now, Megan.
Well, and you know what? I hear that so much. Is this bad enough to get some help? Mm-hmm. And I know I keep harping on it, but I go back to this and I say it almost every single day. It's bad enough if it's causing you trouble, right? And so let's quit looking for that line in the sand, right? Of like, oh, okay, well, if it's sadness, I definitely don't need to see a therapist. But if it's depression, I totally do. Like,
I just imagine someone like moving the line.
We do it.
Pushing it along.
We do it, right?
Totally.
And then we tell ourselves like, well, it's just sadness and it's probably still just sadness. So we keep moving it.
So there's no harm in seeing a therapist. It's not indicative of severity, and it's not a death sentence, and it's not a permanent state. Because I think that is part of the stigma, right? Is that, oh, you see a therapist. Well, now you're one of those people.
It must be real bad. And
Yeah.
Well, and one of the ways that I try to explain the process of therapy to people, I'd find that if you can connect it to something that people are familiar with and sort of have a concept for already, it makes sense. And so if you think about the job of like a personal fitness trainer, right? That person works with clients who may have experienced a very, very severe injury and are learning to walk again. Right? They are healing from something. That person works with somebody who maybe has never walked in a gym before and is like, I don't know really my way around or what I even do with all of these things. That person works with somebody who maybe really does care quite a bit about their fitness and needs someone to sort of take them to the next level. That person also works with the most elite athletes. And so it's not like, oh, well, you must be in really bad shape if you need to have a personal trainer, right? No one would think that, right? You're like, oh, you have somebody helping you with this who knows what they're doing and can help you at whatever phase you're in. So
that's an amazing analogy.
Is that helpful?
Yeah, my mind is blown right now. That is so helpful. And I think it'll be helpful for a lot of people too.
Good.
So, because what you're saying is, try the exercise, try the meditation, do the yoga, do all the things, but also give yourself access to somebody who is an outside party.
You got it.
To check out the situation and see what's going on. And
for sure.
Yeah. It's not a pass-fail situation.
Right. And just, I've never told someone, oh, well, you're only sad, you're not depressed. And so I don't think that I can help you.
Yeah. Or you're so depressed that you're failed. You got an F.
Right. That's not what it's about.
Are there any final thoughts that you want to leave us with on sadness versus depression before we wrap up?
I just think it's paying attention to yourself, acknowledging that, like, hey, if you are sad, it's okay to be. Mm-hmm. And there's a lot of things that are around to feel sad about right now. And sometimes we have to let ourselves feel that. But if it's something that you're feeling to the degree that it's really impacting your day-to-day, then we can do better.
We can do better. That is such a great way to end. We can do better.
I think so.
So where can people find you, connect with you if they want to learn more?
So my website is probably the quickest and easiest and the most information in one place. And that's harbor-wellness.com. I'm also on Instagram and Facebook.
Perfect.
Thanks for listening. If you liked this episode, you'll also like the new Spotify playlist I made of mental health episodes. I put it in the show notes, but if Spotify isn't your thing, you can just check out the episode about grieving, episode 267. Stay tuned next week when I talk with a legal brothel owner. Until then, keep it curious.